Hello friends, today in this session we are discussing about the varicose veins and varicosity. Varicosity is in Ayurveda called as Sira Kautilya, and it looks like in this video there is a small presentation of patient with complaints of dilated and tortuous veins over the lower extremity, and this was the patient who was visited or OPD for the treatment. So we are planning to do some Ratmokshan or Siravet Karma in this patient, but we should know about its etiology and the clinical features and confirm the cause and where is the deformity, where is the pathology actually. Okay, let us see one by one.
ये नसें सारी फूल गई, पहले नहीं थी। बैठने का काम है मेरा तो ज़्यादा।
Etiology. The cause of varicose vein formation is not well understood but can be considered under two headings: primary varicosity and secondary varicosity. Primary varicosity. When varicosity develops without any obvious cause, it is called as primary varicosity, and it may be due to hereditary, due to congenital weakness of the walls or the vein wall. Rarely it may be due to congenital absence of walls. Familial reasons. Varicose veins are more common in certain families. Endocrinal. Hormonal imbalance, especially during pregnancy, may predispose to varicose veins. And contributory factors are obesity, occupation of prolonged standing, and habit of wearing tight garments, muscle weakness leading to poor musculovenous pumping action, and idiopathic primary ankle perforator incompetence are the etiological factors which causes primary varicosity. Now, secondary varicosity. When varicosities develop due to some known cause, such as number 1, proximal obstruction to blood flow, as in pregnancy, abdominal mass, fibroids, ovarian cyst, abdominal lymphadenopathy, pelvic cancer, loaded colon and ascites, and iliac vein thrombosis, retroperitoneal fibrosis are the causes for proximal obstruction to blood flow. Second, destruction of valves as occurs in deep vein thrombosis. Number 3, increased blood flow and venous pressure as in arteriovenous fistula. Number 4, varicose veins associated with various degree of congenital venous anomaly. Example, Klippel Trenery syndrome. Clinical features. The commonest symptom is tired and itching sensation in the affected lower limb, particularly in calf and leg at the end of the day. Patients also complain of tortuous and dilated veins in the lower limb. Pain may be bursting or severe in nature and may be particularly localized to the site of incompetent perforating veins. Patient may often present with no other symptoms except dilated and tortuous veins of the leg. These dilated veins may or may not be associated with following complications like ankle swelling towards evening, pigmentation, itching of overlying skin, and eczema of affected skin. Local examination. Morrissey cup impulse. The limb is elevated to empty the vein, and then the patient is asked to cough. If an expansile impulse is felt in the long saphenous vein, means saphenofemoral valve is incompetent. A single varix situated at the saphenous opening is called as a saphenovarix. Second test, Brodick-Sternberg test. With the patient lying, the limb is raised to empty the veins. A rubber tourniquet is applied at the saphenofemoral junction at the fossa ovalis. It is 4 cm below and lateral to the pubic tubercle. Or directly pressure can be applied by thumb over the fossa ovalis. And observe, normally the gradual filling of superficial veins occur from below after the patient stand. When the pressure is removed, if there is a rapid filling from above means incompetence of saphenofemoral wall. 3 tourniquet test. 3 tourniquets are tied, first at thigh below saphenofemoral junction, second below knee, and third just above knee. These prevent blood flow to each blow out from above as well as below. Now the patient is asked to stand up and appearance of varicosity is looked for within 30 seconds in each segment. The leg is also observed for retrograde filling of the distal segment. After removal of the tourniquet one by one from below upward, the exact levels of perforators can thus be assessed. Perth test. A tourniquet is tied around the upper thigh, tight enough to occult the long venous vein. Now the patient is asked to walk for a few minutes. If the deep vein and perforating veins are functionally normal, the superficial veins shrink. If the superficial vein get dilated, either the deep system is blocked or the perforating veins below the level of tourniquet are incompetent. Pratt's test. This test is to assess the incompetence of perforators. The patient is asked to lie in supine position. An elastic compression bandage is applied from the toe to upper third of thigh to empty the varicose veins. A tourniquet is then tied just above the bandage. The patient is then asked to stand up and the bandage is removed from above downwards. The appearance of blowouts indicates the site of incompetent perforators and are marked by a pen. Investigations: duplex ultrasound imaging, I-125 fibrinogen leg scanning, plethysmography, and venography are the investigations for confirmation of varicosities and the site of the varicosity. And the duplex ultrasound imaging is the investigation of choice. Complications of varicose veins. Number 1, pigmentation. Number 2, eczema. Number 3, ulceration. Number 4, periosteitis. Number 5, thrombophlebitis. Number 6, calcification. Number 7, hemorrhage. And number 8, deformities of the foot like talipus equinus. And number 9, lipodermatosclerosis. Lipodermosclerosis. These are the complications due to varicosity of the veins. Treatment: conservative, avoidance of prolonged standing, elevation of limb, preferably above the heart level during rest or at night will improve venous drainage. Exercise of leg to strengthen the calf muscle, example bicycling exercise. Supporting crepe bandage and elastic stockings are the conservative measures to treat the varicose veins. Number 2, sclerosant injection. Injection of sclerosant, example 5% ethanolamine oleate, into an empty varicose vein will damage the intimal lining of the vein and cause sclerosis of it, leading to complete obliteration of the vein. Sclerotherapy is more effective when varicosity is less than 3 mm diameter. Surgical treatment. Indications for surgical treatment: disabling pain, recurrent superficial thrombophlebitis, erosion of superficial skin with bleeding, venous ulceration, varicosity diameter more than 3 mm, saphenofemoral incompetence, failure of conservation therapy are the indications for surgical management of varicose veins. What will be the aim of operation? To stop retrograde venous flow from deep to superficial vein by ligating the incompetent veins at the following site: saphenofemoral junction, saphenopopliteal junction, or at the incompetent perforating vein. Excision of varicosity. Methods: ligation alone, which is called as the Trendelenburg's operation. Ligation and stripping is a treatment of choice. Stripping means surgical procedure in which the vein is removed with the help of stripper. Number 3, ligation and retrograde sclerotherapy. Multiple avulsion or excision of veins. Cocket and Dots operation is a treatment of choice for incompetent perforators. There are some newer surgical techniques came into the medical field, like number 1, vein wall transplantation, or femoral vein valvuloplasty, or the external vein valvuloplasty are the newer techniques for treatment of varicose veins. There are certain contraindications for surgery and sclerotherapy. Among them, number 1, women taking contraceptive pills, because there are chances of deep vein thrombosis and thromboembolism. Number 2, pregnancy. Number 3, DVT, that is a deep vein thrombosis. And number 4, thrombophlebitis are the contraindications for surgery and sclerotherapy. In the same segment, nowadays the laser ablation therapy for the varicose vein is a popular method to treat the varicose veins. So laser ablation, this treatment is a very good treatment to cure the varicose veins.
Ayurveda view. Identifying the root cause. Accurate diagnosis is very important for effective treatment. According to Ayurveda, an imbalance of the vata plays a pivotal role in varicose veins. The role of rakta and pitta cannot be neglected either. Thus, restoring the vata balance becomes a very important part of the treatment. The vata balance can be easily restored by following a healthy lifestyle and having an equally healthy and nutritious diet. Citrus fruit like amla works miraculously to revitalize the fatigued and varicosed vein. Include fresh fruits, whole grains and proteins in your diet. Drink plenty of water. Red meat and spicy foods should be strictly avoided. Garlic, onion and ginger are very beneficial. Consume them regularly. Do not indulge in rigorous exercise or walking. Never soak your feet in cold water after exercise. It can prove to be detrimental for varicose veins. Do not compromise on your sleep. A rejuvenated body and a relaxed mind can enhance the healing process greatly. A number of Ayurvedic medicines are available that treats varicose veins very effectively. Few examples. Kashora Guggulu, being a natural cleanser of blood, this is an obvious choice for varicose veins. Sarivadhyasva, it goes a long way to detoxify the blood naturally. Chirabilwadi Kashaya, it is very effective in case of hemorrhoids. Sahacharadi, it is amazing herbal oil that provides great relief. Tender application of Sahacharadi over the varicosed veins can work wonders. Herbs like Ashwagandha, Shatavari, Brahmi go a long way to restore the vata balance. Leech application is also useful in early stage to cure. In late stage, leech application can be helpful to reduce or treat complications like pigmentation, swelling, eczema and venous ulcer.